Here we present you with a poster mapping out your road to recovery. We understand this is a very difficult time for you, but just remember that the pain you feel today will be the strength you feel tomorrow. Upon thorough assessment, we have identified several problems in your current state, which we believe by providing you with an understanding of, can be managed and overcome. The first is your reduced ability to functionally use your right arm. The factors contributing to this are the injury sustained to your brachial plexus, your clavicle and humerus fractures, and muscle deconditioning. Nerve roots of C8 to T1 of the brachial plexus have been damaged from the incident, causing impaired conduction along the ulnar, median and radial nerves, and therefore reducing motor control of the hand. This, alongside the doctor's no weight bearing orders to facilitate bony healing, has resulted in muscle deconditioning. Although the fracture sites were fixed to restore their anatomical position, they require immobilization to facilitate remodeling over the 6 weeks following surgery. During this immobilized period, your muscles have unfortunately lost mass and volume due to protein breakdown exceeding synthesis, ultimately impairing your strength and functional use of your right arm. The next problem listed is the reduced ability to mobilize independently. This is a number of factors contributing. Firstly, your reduced trunk and lower limb strength are both most likely caused by deconditioning, which is also known as muscular atrophy. This has been shown to occur after as little as 5 days of inactivity. Your trunk muscles are activated during all movements involving the torso and are vital for adequate breathing function, whilst the strength of your lower limbs is required to ambulate and move in bed. Second contributor is your weight-bearing status. Due to the healing process of various soft tissue structures previously mentioned, you are currently not able to bear weight through both your upper limbs and your left lower limb. This will resolve over the next few weeks, however, it is currently limiting your mobility. And lastly, your pain sensation. As I'm sure you're aware, the pain you are experiencing is limiting your ability to move, as it risks placing pressure on damaged and inflamed tissues. Appropriate pain management will assist with your daily mobility and in rehab. The next problem listed was the risk of developing pulmonary complications, such as pneumonia. The factors contributing to this risk are your current pain levels and changes in your chest wall and breathing mechanics due to the rib and clavicular fractures. The evidence suggests that 1 in 3 rib fracture patients will develop pneumonia, which results in increased hospital length of stay. This is due to the reduced lung volumes, which brings down the functional residual capacity and risking lung collapse. Another contributor is impaired airway clearance. This is from pain inhibition on the respiratory muscles such as the abdominals and results in an ineffective cough to mobilize bacteria and secretions from the lungs. The next problem listed for you was the limited ability to undertake studies. So we understand a concern of yours is surrounding the completion of your studies. And from what we know, your motivation, pain levels, functional mobility status, and current point in the rehabilitation pathway are all contributing to this problem. This stress and lack of motivation are normal psychological responses which often proceed after such traumatic events. We know that physical trauma will regularly have a carryover effect on the psychological state and can result in reduced mood, drive, and hyperarousal.
It's important throughout this journey we keep in mind the set of goals we developed together today, the first of which being able to independently sit out of bed to study in 2 weeks, second of which being able to independently get to the gym to complete your training at the Royal Talbot in 4 to 6 weeks, and third of which being able to independently move around university campus with any necessary aids in 3 months. Now these goals may seem out of reach at the moment, but rest assured are more than achievable through commitment to your treatment plan and with us by your side.
Our treatment plan is designed around improving your mobility. Keep in mind that you will be working with an occupational therapist, speech pathologist, the medical team, nurses, psychologists, and more with the aim of safely getting you home. We've mapped out a road to recovery. The pink car represents where you are now. We encourage you to remove the car and pin it along the road as you progress. So our first goal is to get you to be able to sit out of bed to study and perform basic activities of daily living by week 3. Sitting unsupported is an integral part of transfers, dressing and studying for long periods of time. This position is even more unstable when we reach and grasp for objects, and so there is an increased risk of falling. Normally, our instinctive response is to recruit the trunk and leg muscles to avoid falling over. so adequate strength and control of these muscles is vital. Research supports the idea that truncal exercises in bed should be included in recovery. Rolling is used to dress, move around in bed, and is a requirement to get from lying to sitting. We will familiarize ourselves with the log roll technique. It is important that we precisely practice the task we want to learn to build a connection between the mind and the body. We want to perform these novel tasks automatically, in a sense. This is based on the motor schema theory. Do not be disheartened if we cannot perform the whole task instantly. We will break it into subtasks, get those little wins, and make progress. Once your left wrist is taken out of its thermoplastic splint in week 2, you will feel more independent and free with your movement. We want you to be able to use your left hand to study and practice using a mechanical wheelchair. We will work on the range of your wrist and hand and wrist strength with exercises and assisted movements. It is important that you move regularly to prevent pressure sores, sit up slowly to avoid feeling dizzy, follow all the no weight bearing orders to allow your bones adequate time to properly heal, avoid twisting to protect your spine after the surgery, take your time and concentrate on bracing when seated to avoid falls. It is extremely important that you reach out to a psychologist, family and friends when you feel demotivated or low in mood.
Within weeks 3 to 6, we will be working with you towards your goal of being able to get to the gym yourself in 4 to 6 weeks. To do this, we need to get you independent with all transfers. Achieving adequate standing balance when able to weight bear in your cam boot will be essential for your safety when mobilising, reducing your risk of falling, as this is still a precaution during this stage. During this block, we will continue to build lower body and trunk strength, whilst keeping your sessions with us task and skill specific. Achieving safe, independent transfers will be one of the main criteria needed to be met for your discharge home. Increasing range of motion and strength of the left ankle will be another focus, as we expect a marked reduction in active ankle range once out of your plaster. Research tells us that adequate range of motion and calf strength is necessary for the performance of functional activities such as walking, stair climbing and squatting, and we believe you'll be doing these exercises before you know it. Strength training will begin with isometric exercises, progressing to concentric through full range. Finally, we will work with you in progressing towards independent walking. Progressing through this stage of your rehab will depend on adequate bone healing, your standing balance, lower limb strength, and ankle range of motion, which we will be testing with you regularly. At week 4, we are aiming to have you weight bearing as tolerated through your left leg and both upper limbs. We will first utilise the 4-wheeled gutter frame to get you to and from the gym, as well as domestic distances. Once in the gym, we'll be working more closely on the development of your regular walking pattern with the parallel bars. We see no reason why you won't be walking independently by the end of this 6-week block, as you have lost very little lower limb strength and you are coming from an active baseline. We'll be here to motivate you every step of the way.
6 weeks onwards will be the last leg of the race. It'll be time for you to go home. It won't be goodbye though. We'll be working with you twice weekly in our community setting for 6 months in order to achieve your goal of independently moving around university campus with any necessary aids in 3 months. To do this, we'll need to get you safely discharged home with all the necessary supports. Sessions with us will continue progressing your lower limb and ankle strength against resistance, as you'll be strong enough to weight bear. We'll also work on fine motor skills to restore movement patterns and challenge your proprioception and balance. Proprioceptive work will be challenging but fun. We'll put your mind and body to the test in weight-bearing exercises on an unstable surface, such as a foam mat. Evidence tells us that proprioceptive and balance work is essential post-ankle fracture to stabilise your joint during walking and reduce falls risk, which is still a precaution for you. Evidence suggests continuing progressive resistance training within our community setting will reduce your pain and increase your ability to undertake activities such as studying and walking. Although not required when resting and exercising, it's important you wear your cam boot when walking for a further 3 weeks following discharge to prevent disrupting the healing process. We also have a small home exercise program for you to complete once daily. The exercises will only take you around 10 minutes. Think of them as a study break. These exercises will continue strengthening your lower body, like we worked on during weeks 3 to 6, but using a special resistance band to further challenge your muscles. We encourage you to be active during your time at home, regularly stretching your limbs through full range to prevent stiffness. For further precautionary information across all weeks of your treatment plan, please familiarise yourself with the list on the right side of the poster. All in all, we hope this poster helps you understand and visualise your journey home. Just remember, Trudy, we're all behind you in this challenging time. Never hesitate in reaching out if you need anything. We are by your side.